Fasting is a really big topic right now in all the healthcare and longevity circles. And with that, let's dive into what we need to do. Like, what are the things that you need to watch out for if you choose to do this? I'm Dr. Jeff Cumro, and over the past 15 years, I've been blessed to work with thousands of people, ultimately helping them improve their brain function, helping them improve their body function, and then supply the energy to those areas so that, if they have ADHD and they're trying to learn, they do better. If they have a lot of stress and they're trying to advance their career, they do better. If they're trying to just relax and go to sleep, they do better. When we have all of those things functional, everything just works better. It's much, much easier on us. So let's dive into the question, is fasting right for you? And what are the pitfalls that we have to watch out for? So what is fasting, first of all? Fasting is just going an extended stretch without food. And you see intermittent fasting, there are a lot of people that are doing this right now. Intermittent fasting is something that I'm a big fan of for most people, but there are people that do have to watch out for this. So, what ultimately is the reason behind doing the fast? So what we want as humans is we want to be adaptable, right? We want to be flexible in how we go about life. And our energy production is the same way. We don't want to just rely on sugar all the time. When we rely on sugar, we're very vulnerable to things like diabetes, right? If we can burn fats, that's a whole different source of energy. And the difference between these is fat is kind of like throwing a log on a fire. It sits there and it burns and produces good heat for a long period of time. If you throw carbs onto the fire, it's the grass and it goes quick. It's just flash and it's over. And you'll notice this in our blood sugar levels, right? So if you eat a bunch of fats, your blood sugar level stays pretty consistent. If you eat a bunch of carbs, you see this in your blood sugar levels. There's ups and downs. It rises and falls. And the danger in that is as it shoots up and it shoots down, we rely on insulin, right? So that's kind of the whole theory behind this, is if we work on the flexibility where, in that short time that we go without food, we're relying more on those fats to supply the energy that we need. We're just getting a little bit more flexibility in how we go about this, right? So if you're doing intermittent fasting, what is the risk of this? If you have any kind of blood sugar disorder, a metabolic disorder, it can be a little bit harder for you to maintain your blood sugars. This can be a problem, right? If you have too big of a drop in your blood sugar level, that's going to be a big problem. So consult with your doctor before you start doing this. People with thyroid issues can run into similar things. So there are people that do have to watch out for this a little bit more. But there are different types of intermittent fasting. There are people who, like a 12-hour fast. They don't eat for 12 hours. They get all of their food within the other 12 hours of their day. There are people that do 15 hours. There are people that do 18-hour fasts. There are people that do 20-hour fasts where they're getting their food in shorter periods of time. Now, if you are going to start with a shorter fast, right? So doing maybe like a 12 and a 12. I think that's a great place for many people to start. But again, consult with your doctor because this can be dangerous for the wrong populations. Now, the bigger threat that I'm seeing is there are a lot of people that are doing 1 day, 3 day, 7 day fast, 5 day fast, different things like that. They're doing these longer periods of time. And ultimately what we're seeing is, so the whole purpose behind this, first of all, what we're looking for is what happens during this fast. We start relying more on that ketones, the fats, different things like that to supply our energy. Unfortunately, what happens during there is we also eat up some protein. And, we use that for energy as well. And that's not necessarily a bad thing. That's part of the reason that we're looking for this. So when we're looking at the longer term fasts, what we want to look at is when we take a cell and that cell replicates over and over again, it's kind of like, if you remember the old photocopies, if you make a photocopy of a photocopy of a photocopy of a photocopy, et cetera, sooner or later, the beginning and the end product don't look the same, right? The first one is a nice clear copy. The last one is kind of fuzzy. It's hard to read. It's just not nearly as good. These cells go through that same thing. As they replicate over and over again, they start to get less and less functional. And what can happen is you build poorer and poorer proteins out of all of that. So what our body does through this fast is it goes through and it gets rid of a lot of those. It's called autophagy. And that autophagy can be a very, very good thing. It can help to prevent Alzheimer's. It can help to make better, it can help to prevent cancer. It can help to make better proteins in general. This is a very good thing overall. But the question is it worth it? And the reason I ask that, for many populations, what is the biggest threat to our health long term? It's a loss of strength. It's a loss of movement, right? So what we see through this period is we lose a lot of muscle mass because our body starts breaking down those proteins. And as we start losing that muscle mass, we start losing strength. And that strength loss can be a very, very big predictor of what our longevity is long term. Now, what we see in longevity is people that are very, very skinny don't do as well as people who are even a little bit overweight. And the reason is they lose their strength. They lose their ability to, they have a fall and they hit their head, or they can't do the things that they need to do through everyday life. And they end up in nursing homes and different things like this, where they're more vulnerable to infection and all of those things that go with being in a crowd of closely knit, less healthy people. So there are definite inherent risks to this. And what we have to weigh is it worth it for you? In some cases, it may be. If you're morbidly obese, then it may be worth it for you. That's just something that we have to elucidate. These are the questions that you're going to have to ask your doctor is should I do this? Is it worth the risks for me? And like I said, in some cases, it may be. Doing this once a year, you may be okay. But stereotypically speaking, what happens is we lose anywhere from 1 to 4% of our strength per year after 40. Depends on which research you read. Some of them say 1%, some of them say 2%, some of them say 4%, some are 1.5%. There's different research out there, but anywhere in the range of 1 to 4% loss per year after the age of 40. And obviously some of this depends on, how well we're able to maintain our muscle mass. So how we eat, how we live, what types of exercise we do, things like that. But it also, the bigger correlative here is how strong we are. So just because you're a smaller person doesn't mean that you can't keep the benefits of this. If you are able to maintain your strength, if you are small but you have that wiry strength, you're probably going to see just as good outcomes as somebody who's really, really muscular, right? Just because you have a lot of muscle, if it's not good functional strength, you're not going to see as good outcomes. So it really comes back to the quality of the muscle, quality of the strength that you have, and your ability to sustain that over the long period of time. But these are the things to ask if you're looking for a fast. Obviously, if you have questions for me, put them in the comments. Liking and subscribing if this was something that was helpful for you. But there are definite questions that we need to ask before we start doing some of these fasts. The intermittent fasting is something that I think is great for a lot of people. And a lot of people, even if they do have diabetes and thyroid disease, can work into doing that. But be safe, talk to your doctor, see what risk factors you have and the things that you're going to have to watch out for. So as always, I love and appreciate y'all. I appreciate your attention. I know that that's your greatest resource, and I appreciate you spending some of that with me, and I'll catch you on next week's video.